It can be tempting as you approach Medicare eligibility to immediately want to focus on deciding between the right Medicare Advantage or Medicare supplement coverage for you. But first, let's take a step back and discuss the basics of the Medicare system in this Medicare 101 video. Together, we will demystify Medicare, simplify your options, and help you make the most informed decisions about your healthcare. We will break down the A, B, C's, and D's of Medicare, exploring the cost, eligibility, coverage, and more. My name is Cameron Giardini, and at our independent Medicare-focused insurance agency called Giardini Medicare, we have helped several thousand consumers understand the basics of Medicare during their transition to Medicare, and we hope to do the same for you. Medicare has been a crucial lifeline for many people since it was first signed into law on July 30th, 1965 by President Lyndon B. Johnson. It was part of a vision for a great society where seniors could access quality healthcare without the fear of insurmountable medical bills. Initially, Medicare only covered hospital insurance, now known as Part A, and medical insurance, now known as Part B. But it has expanded to accommodate the changing healthcare landscape and needs of beneficiaries. But what exactly is Medicare? Officially, Medicare is a federal program that provides health coverage if you are 65 or older, or if you have disabilities or other qualifying conditions before age 65. The program is run by the Centers for Medicare and Medicaid Services, which is known as CMS, and it is a federal government agency. Now, when it comes to understanding Medicare, remember, it's just another form of health insurance. Sure, it is different than the coverage you have had in the past, but at the end of the day, it's another type of health insurance that over time you will get used to. Real quick, in addition to this video, don't forget to access our free online course at gmedcourse.com to learn about hundreds of Medicare topics at your own pace. So again, click the link in the description below if you'd like to access that. Now let's dive into the alphabet soup of Medicare. There are four main parts you may have heard of. Part A provides hospital insurance, which covers inpatient hospital stays, care in skilled nursing facilities, hospital care, and some home health care services. Now Part B, on the other hand, provides medical insurance, and it covers most doctor services, outpatient care, medical services, and preventive services. Together, these two, Medicare Part A and Part B, make up what is known as Original Medicare or Traditional Medicare. Those are the same thing. Part C is not actually a part of Original Medicare, and instead Part C refers to Medicare Advantage coverage, which is a bundled alternative to Traditional Medicare, which is also offered by private insurance companies which are approved by Medicare. Now these plans, they include Part A and Part B services, and they usually include Part D coverage, which naturally brings us to the last letter associated with Medicare, which is Part D, and that again, it provides coverage for prescription drugs that you receive from the pharmacy not covered by Original Medicare. Just like with Medicare Advantage plans, Part D plans are provided by private insurance companies that contract with Medicare. Now, in addition to these four parts of Medicare, there are also Medicare supplement plans, which are known as Medigap plans. These can be purchased as secondary coverage to Original Medicare to help with the out-of-pocket costs that Medicare does not fully cover. Like with Medicare Advantage plans and Part D plans, of course, these are provided by private insurance companies, but if you want to learn more about Medigap coverage, make sure to watch our other videos after this one. Of course, there are more details when it comes to what is and is not covered by Medicare, but that overview should at least provide a good starting point to help you understand the basic differences. You can also reference the official Medicare and You handbook for more of an overview of these coverages. Also, please do not forget to like this video and subscribe to our channel so that you will be notified when we release new videos. So while Medicare is often associated with turning 65 years old, it's important to note that certain groups of people can qualify for Medicare before age 65, like we mentioned at the beginning. One such group includes individuals with qualifying disabilities. So if you've been eligible for disability benefits from Social Security or Railroad Retirement Board benefits for 24 months, you'll automatically qualify for Medicare regardless of your age. Furthermore, individuals that are diagnosed with amyotrophic lateral sclerosis, which is more commonly known as ALS or Lou Gehrig's disease, they are also eligible for immediate enrollment in Medicare. There's no 24-month waiting period for those with ALS, and they are eligible for Medicare the first month they are entitled to Social Security or ESRD disability cash benefits. Last but not least, there are people with end-stage renal disease, also called ESRD. According to CMS, individuals are eligible for premium-free Part A if they receive regular dialysis treatments or a kidney transplant, have filed an application for Medicare, and meet one of the following conditions that you can see here on the screen. But what about the vast majority of people that are not eligible due to disability but are instead eligible when they turn age 65? First, you will want to determine if you are eligible for premium-free Part A of Medicare or not. Fortunately, according to Medicare, 99% of Medicare beneficiaries qualify for premium-free Part A, so most of you watching this video won't have to worry about these details, but still we want to cover this topic briefly. To be eligible for premium-free Part A of Medicare, you must have enough work history, typically from your own or a spouse's work record. You will have to meet the minimum requirement of working 40 quarters, or 10 years, and paying Medicare taxes through FICA taxes during that time. Now, according to Social Security in 2024, you receive 1 quarter of coverage for each $1,730 of earnings, up to a maximum of 4 credits per year. Now, if you're unsure about whether or not you have enough work credits to qualify for premium-free Part A, luckily, you can find this information by logging into your Social Security website portal, and it should be on the homepage just like you see here on the screen. If you're turning 65 and you don't have 40 work credits on your own, you may be able to qualify for premium-free Part A using your spouse's work history, as long as your spouse with the proper amount of credits is eligible for Social Security retirement benefits or eligible for Social Security disability benefits. Although it's really important to note that your spouse only has to be eligible for Social Security benefits. They don't actually have to start collecting them for you to use this method. You will also want to make sure that you have been married for at least 1 year before you can qualify for premium-free Part A using your spouse's work history, and there is additional criteria if you are divorced or widowed, so you can see those here on the screen. Now, just one more quick note in case this applies to you. Some public employees, they are not covered by Social Security, but they still pay their Medicare portion of FICA taxes, and they may still be eligible for premium-free Part A, what is known as a Medicare qualified government employee. So make sure to reach out to Social Security if you think that might apply to you. Now switching to Medicare Part B eligibility, if you are eligible for premium-free Part A, you are also eligible for Part B of Medicare due to age when you are 65 or older. Now, if you do have to pay for Part A, you will have to meet the following eligibility criteria that you can see here on the screen to enroll in Part B. Now, this can seem like a lot to keep track of, and there is just far too much to cover in a Medicare 101 video, and that is why we have included a Medicare eligibility calculator down in the description under this video that you can use. This handy tool, it's provided directly by Medicare itself, and it can guide you through Medicare eligibility, the process, and it can provide clarity of what is often a confusing topic. So please make sure to check that out if you have any questions. Hopefully now you have a better understanding for what Medicare is, and at least you know how to find out if you're eligible for it. Now comes another very important question, which is, what does Medicare actually cost? Now, contrary to what some people think, it is certainly not free. We'll start with Medicare Part A. Again, the vast majority of Medicare beneficiaries will qualify for premium-free Part A, so in that case the coverage would be $0 per month, but what does it cost if you don't qualify for that? Now, in 2024, if you paid Medicare taxes for 30 to 39 quarters, you'll pay $278 for your monthly premium for Part A, but if you have paid taxes for less than 30 quarters, then the premium actually goes all the way up to $505 per month. But luckily, that won't apply to most of you. Now let's move on to Medicare Part B, which again, it covers doctor services, outpatient care, medical services, and preventive services. Now, unlike Part A, Medicare Part B, it does come with a monthly premium for virtually all Medicare beneficiaries. So as of 2024, the base Medicare Part B premium is $174.70 per month. However, the premium, it can be higher depending on your income, which leads us to the topic of IRMAA. Now, IRMAA, it stands for the Income-Related Monthly Adjustment Amount. You don't have to know that exactly, but essentially, if your modified adjusted gross income, as reported on your tax return from 2 years ago, is above a certain threshold, you'll pay the standard Part B premium of $174.70 per month, plus an additional amount every month. Now, this can range from an extra $69.90 per month month, all the way up to an additional $419.30 per month. So this means in 2024, the highest income earners, you could pay $594 per month for just Part B of Medicare, which is certainly far from free. IRMA does not just affect Part B premiums. If you have Medicare prescription drug coverage through either Part D or Medicare Advantage plan, you may also have to pay more for that coverage due to IRMA. So again, on the screen, you can see the IRMA amounts for prescription drug coverage, which can be as high as an additional $81 per month to your Part D monthly premium. We know IRMA can be complex, so make sure you check out our free online course at gmedcourse.com for way more details about IRMA. There we also discuss how you can even appeal an IRMA decision if you've experienced a life-changing event that has reduced your income, and we provide you the tools to do so. Now, instead of IRMA, if you're concerned with having to afford just the base monthly premium of $174.70 per month, you will want to consider and look at Medicare savings programs. We won't get into too much detail about these programs in this video, but just know that Medicare defines these state-based programs that may pay your Medicare premiums and various out-of-pocket costs depending on your income and resource levels. Now, if you have currently or if you have had Medicaid in the recent past, this is definitely something you will want to look into. Lastly, when it comes to Medicare costs, remember that Part A and Part B, they are likely not all you will have to consider. Most Medicare beneficiaries enroll in either a Medicare Advantage plan as an alternative to Medicare or a Medicare supplement plan and Part D coverage to go with your original Medicare. Now, whether or not you choose Medicare Advantage or Medicare supplements, you will still be responsible for paying your Part B premiums like we just talked about, but according to CMS, the average monthly Medicare Advantage premium is $18.50 per month in 2024. However, according to the Kaiser Family Foundation in 2023, 66% of all Medicare Advantage plans are offered at a $0 per month premium, which is about the same for 2024. Now, on the other hand, Medicare supplement plan premiums, they are highly dependent on where you live, but as an example, a Medicare supplement Plan G for somebody 65 years old in Michigan, it might range from $100 to $140 per month, with Part D being an extra expense in addition to Medigap coverage, and CMS even reports that the average Part D premium is $55.50 per month, but just know Part D premiums range from as little as $0 per month all the way to triple digits per month in premiums. And we just mentioned the example in Michigan, but on your screen you can see a map of the US, and you can get a general idea for what Medigap plans might cost monthly for a 65-year-old in your state. But now that you understand the monthly costs and eligibility of Medicare, you have to know how to navigate the Medicare enrollment process so you have the right coverage at the right time. Now, for the sake of keeping it a little simpler in this video, we will briefly discuss the common Medicare enrollment periods for those enrolling in Medicare at age 65. We will have other videos discussing these in more detail in the future, but here's a good head start. Now, first, as you approach age 65, you have what's called an initial enrollment period, which is shortened to IEP a lot of times. Now, this begins 3 months before the month you turn 65, includes the month you turn 65, and it ends 3 months after the month you turn 65. And just a quick note, if you were born on the first of the month, whatever month it is, your initial enrollment period, it will actually begin 1 month earlier. And you can see an example of the IEP timeline right here. Now, if you're already collecting retirement benefits from Social Security at least 4 months before turning 65, you'll likely automatically be enrolled in Medicare Part A and Part B starting the first day of the month you turn 65. A Medicare card, it will be mailed to you about 3 months before your 65th birthday, along with a Welcome to Medicare packet from the Department of Health and Human Services, and we will link to an example of the package in the description below. Now, at this point, if you do want to have both Part A and Part B take effect when you turn 65, there's nothing else you need to do, and your Medicare will be effective when it says on your red, white, and blue card, and your monthly premiums are going to be automatically deducted from your monthly Social Security benefits. However, if you do want to delay your Part B past age 65, typically due to having active employer coverage from an employer with 20 or more employees, you will have to check the box on the back of your card stating you do not want Part B. You will have to sign the card and send it back with the enclosed necessary forms before the effective date shown on your Medicare card. But what if you're not collecting Social Security benefits at least 4 months before turning 65. Now, in this case, it's very important to know Medicare enrollment, it's not automatic. So if you want coverage to begin when you turn 65, make sure you do not sit back and wait for it to arrive. Even if you plan on delaying Medicare Part B, you may still want to have Part A only, and you will have to actively apply for it. Now, there are a few options for enrolling in Part A and Part B if you are not collecting Social Security benefits. You can apply online at the Social Security Administration website. This is a quick and easy process that is typically completed in about 15 minutes. Otherwise, you can also apply in person at your local Social Security office, or you can call the Social Security Administration over the phone and apply that way. Just remember, if you want your coverage to begin the first day of the month you turn 65, you will want to apply 2 to 3 months before you actually turn 65 to avoid any last-minute stressful situations. What happens if you are one of the many people that delay Part A and or Part B though past age 65 due to active employer coverage through yourself or a spouse? This is becoming much more popular, so we have to talk about it. Now, although your initial enrollment period, it ends 3 months after the month you turn 65, luckily in this case, you are not out of luck. You will likely have access to a Part B special enrollment period, also called an SEP. This occurs while you are covered by employer group health coverage due to current employment, and it ends 8 months following either the month your employment ends or your medical coverage through your employer ends, whichever comes first. Now, as of 2023, there are also new Part B SEPs. You can see these here listed on the screen, but again, we will discuss those in other videos. Now, last but not least, for Medicare enrollment periods, if you miss your initial enrollment period and don't have access to a Part B SEP, you will likely have to enroll during the general enrollment period, also called the GEP. Now, this occurs from January 1st to March 31st of every year, and if you enroll in Medicare during this time period, your coverage will begin the first day of the month after the month you apply. So, quick example, if you apply in February, this would result in a Part B effective date of March 1st. You might have noticed by now, but Medicare effective dates are always the first day of the month, so don't expect to have coverage start in the middle of the month or towards the end of the month. Now, the enrollment periods we just discussed, they are very important to know, since missing the proper enrollment period, it can result in dreaded Medicare penalties, which we'll briefly highlight right now. And when it comes to Medicare penalties, it's good to know that the only possible penalties are Part A, Part B, and Part D penalties. First, the Part A penalty, it's very uncommon, since, like we talked about, it will only occur if you don't qualify for premium-free Part A of Medicare. Here on the screen, you can see examples of the Part A penalty. Now, luckily, this is not a lifetime penalty like the other two that we will discuss. Although still fairly rare, the most common Medicare penalties are associated with Part B and Part D. Now, if you missed your Part B IEP and you don't qualify for a Part B SEP, and instead you have to use that general enrollment period like we talked about, you may be subject to a Part B penalty, which is 10% of your Part B premium for each 12-month period you could have had Part B, but you did not. This is a lifetime penalty, and you can see cost examples right here on the screen from Medicare.gov. Now, last but not least, you may have a Part D penalty if you go without Part D or other creditable prescription drug coverage for any continuous period of 63 days or more after your initial enrollment period, which was that IEP. You can see a cost example from Medicare.gov for the Part D penalty here on the screen. Now, just know that a lot of times, like we talked about, if you're delaying Medicare due to employer coverage, a lot of times that employer prescription coverage is creditable for Part D, but you will want to check with your employer to confirm that. Also, luckily, if you're watching this video, you should be able to easily avoid all of the penalties we discussed. Don't forget to share this video with your friends or loved ones so that they can also avoid any possible lifetime Medicare penalties. So now that you know when to get Medicare, how to get it, and what it will cost, let's finish this video by highlighting what each part of Medicare actually covers. Starting with Part A, Medicare Part A, often referred to as hospital insurance, it typically covers inpatient care in the hospital. This can include semi-private rooms, meals, general nursing, and drugs as part of inpatient treatment. And Part A also covers skilled nursing facility care, hospice care, and home health care services. But remember, it's always best to confirm with your service provider about what Medicare will cover before you begin any treatments. Also, although we say Medicare covers something or it covers different services, it does not mean mean that Part A will cover 100% of the cost for this care. Instead, there are out-of-pocket costs like deductibles, co-pays, co-insurance that you will have to be responsible for paying if you only have original Medicare. You can see an overview of these costs here. It's good to understand some of these costs, but please don't stress too much about memorizing these numbers, since a lot of you will be enrolling in a Medicare supplement or a Medicare Advantage plan, which will cover some or all of these costs, or at least change what you see on the screen. Now, on the other hand, Medicare Part B, often referred to as medical insurance, it covers two types of services. The first is medically necessary services, or services to diagnose or treat medical conditions, and the second is preventive services, or healthcare to prevent illness or detect it at an early stage. These can include things like doctor visits and treatments, outpatient surgery, x-rays, radiology service, clinical research, ambulance service, durable medical equipment, mental health services, and much more. I know that was a mouthful, so we'll have some of these services listed on the screen. Medicare Part B is what most people think about when talking about Medicare. The reason for this is that it provides the medical coverage you will often use at the doctors, like we just said. This is also the 80-20 coverage you may have heard of, which means that after you pay your Medicare Part B deductible, which in 2024 is $240, Medicare Part B will step in and cover 80% of the costs for Medicare approved services, and you will be responsible for the remaining 20%. Now, the key to remember is that, again, these services, they have to be Medicare approved. So check with your providers beforehand to make sure these services are medically necessary according to Medicare. In addition to knowing what Medicare covers, it may be even more important to know what Medicare likely won't cover. We will have more videos about this in the future, but for now, just make a mental note that original Medicare, it will not cover a lot of the following services. This will include long-term care and custodial care, most dental care, routine vision services such as routine eye exams and prescription glasses, cosmetic surgery, hearing aids and exams to fit them, as well as routine foot care. Now, to find more about what services are covered or not covered by Medicare, of course we'll have other videos, but you can also go to medicare.gov, or you can download the What's Covered app on your smartphone. Now, we have talked a lot about original Medicare in this Medicare 101 video, but overall, your cost, coverage, and experience with the Medicare system, it's going to vary greatly based on whether or not you enroll in a Medicare Advantage plan as an alternative to original Medicare, or if you keep original Medicare as your primary coverage and enroll in a Medicare supplement as secondary coverage, as well as Part D prescription drug coverage. Now, luckily, we have a video describing the differences between these two options in just under 10 minutes. So make sure to watch that video right now.